Okay, sorry for the delay, everyone. We were just waiting for some more folks to log in. We've got quite a few people on here tonight, but I'd like to welcome everyone to the Dayton VA Medical Center's Learning About the PACT Act webinar. We are really thrilled to be here with you tonight. I want to start by saying that this event is being recorded, so if there's something you missed or later want to rewatch, you'll be able to do that. We will be sending you a link to that recording after this event, probably sometime tomorrow. You can also share that link with anyone you feel may benefit from the information we're sharing here tonight. I'm Scott Leese with the Community Outreach Office at the Medical Center, and I am an Air Force veteran and, like many of you, had many questions about VA healthcare. Let's see if we can answer your questions this evening about the PACT Act. Please realize that as a participant in this session, your microphone has been muted to minimize distracting background noises. We have quite a few participants on the webinar. I think we had over 80 people register for this event tonight. This is why we're keeping everyone muted. Again, this is simply to ensure there isn't any excess distracted background noises. That doesn't mean we don't want to hear from you. If you have a question or a concern, you can share it with the panelists anytime through the chat pane. You should be able to find this pane on the bottom right of your screen. Simply type in your question and one of the presenters will get to you as soon as they can. For the sake of time, if we don't get to your question during this presentation, you can reach us by phone or by email, and we'll provide that contact information at the end of this presentation. So we are here tonight to talk about some very exciting news. President Biden recently signed into law the PACT Act, which is expanding healthcare to more than 6 million veterans, many of whom were not able to receive care through the VA before. The PACT Act is perhaps the largest healthcare and benefits expansion in VA history. The full name of this law is the Sergeant First Class Heath Robinson Honoring Our Promise to Address Comprehensive Toxins, or PACT Act. It expands and extends eligibility for VA health care for veterans with toxic exposures and veterans of the Vietnam, Gulf, and post 9/11 eras. It's adding more than 20 new presumptive conditions for burn pits and other toxic exposures. It's also adding more presumptive exposure locations for Agent Orange and radiation. It's also requiring the VA to provide toxic exposure screenings to every veteran enrolled in VA healthcare. It's also helping us research staff education and treatment related to toxic exposures. So the VA is very excited about where we're going with the expansion through the PACT Act. For those who are already enrolled in the VA chain, I believe most people here on this webinar tonight are already enrolled with the Dayton VA. This legislation is actually affording many the opportunity to acquire or increase their disability rating based on presumptive conditions associated with military service during a wide range of military conflicts and theaters of operations identified in the PACT Act. And that's what we're here to talk to you tonight about, how the PACT Act might increase your access to VA healthcare and benefits. We're going to share a short video that highlights what the PACT Act is all about. So if you'll just sit back and relax, we'll go ahead and run that video and let you enjoy this brief video.
Hello and welcome to another episode of the SITREP. With the signing of the PACT Act, VA now has a huge list of presumptive conditions attributed to burn pits or other toxins. They also have a new extensive list of locations where they presume these exposures occurred. With regard to presumptive conditions, the list includes brain cancer, gastrointestinal cancer of any type, glioblastoma, head cancer of any type, kidney cancer, lymphatic cancer of any type, lymphoma of any type, melanoma, neck cancer, pancreatic cancer, reproductive cancer of any type, and respiratory cancer of any type. Illnesses that are now presumptive include asthma that was diagnosed after service, chronic bronchitis, COPD, chronic rhinitis, chronic sinusitis, constrictive bronchiolitis or obliterative bronchiolitis, emphysema, granulomatous disease, ILD, pleuritis, pulmonary fibrosis, and sarcoidosis. Locations for presumptive exposure on or after August 2nd, 1990 include Bahrain, Iraq, Kuwait, Oman, Qatar, Saudi Arabia, Somalia, UAE, and the airspace above any of these locations. To find out more information about how the PACT Act affects you and your VA benefits, be sure to subscribe, as the SITREP will be publishing lots more content. You can also visit VA's comprehensive website about the PACT Act by visiting va.gov/PACT, where you'll also be able to apply for VA healthcare or apply for or submit a supplemental claim for VA disability. Or you can always call VA's information hotline 24/7 at 1-800-698-2411. Thanks for tuning in, and please hit that like button, which helps us reach and connect veterans with the benefits they've earned and deserve.
Fortunately, we have with us here tonight some experts that are going to tell you in detail about the PACT Act. We did learn a little bit about the PACT Act from the video we just watched. There's a great opportunity for veterans from a wide range of service to gain access to more care and benefits through this new legislation. And the Dayton Medical Center is very excited about how we may now serve more veterans and the extension and expansion of healthcare through the PACT Act. We have with us tonight, live this evening, some experts to help answer any questions you may have. First, we have Mark Rohner, our PACT Act Program Manager for the Dayton VA, Forrest Farnish, a PA and lead environmental health registry clinician, James Bird from Enrollment and Eligibility, and Larry Zito from the Veterans Benefit Affairs Office. Again, I'm Scott Leese with the Medical Center's Community Outreach Office. I am an Air Force veteran and will help answer any questions you might have about the Dayton VA Medical Center in general. Now, before we begin with questions, Mark Rohner is going to give you a brief presentation that's going to go into more detail about the PACT Act and help give you some more information than what you might have seen with just the video. So, Mark, if you'd like to begin sharing screen and presenting your slides.
Okay, everyone, just bear with me for a quick second, and I will start our slideshow presentation. So first off, we're here for the PACT Act, which is honoring our promise to address the comprehensive toxins. That's where the PACT comes in, Act of 2022. Oops, sorry. The purpose of the PACT Act is multi-phase. It defines what toxic exposure is, goes into some of the healthcare eligibility changes, toxic exposure screening and education, toxic exposure research, and presumption of service-connected changes. So, honoring our PACT Act. As previously mentioned, the Senate's Veteran Affairs Committee named the bill after Sergeant First Class Heath Robertson, who was deployed to Kosovo and Iraq with the Ohio National Guard. After returning home from his last deployment, the doctors diagnosed him with an autoimmune disorder and late-stage lung cancer. Both were later associated with burn pit exposure. Unfortunately, Sergeant First Class Robinson passed away in May of 2020, and he was only 39 years old. So how will the PACT Act help the VA serve our veterans? So the VA remains committed to ensuring that all veterans and their family members receive the benefits and care they have earned and deserve. The PACT Act is expected to be one of the largest expansions of veteran benefits and healthcare in the VA's history and could impact up to several million veterans. The VA will ensure that a veteran-centric approach to timely and efficient delivery of healthcare and benefits is executed. The law includes the tools and resources to ensure that the VA can effectively implement and meet the growing needs of veterans today and into the future. So the military environmental exposure. This can include exposures of a wide range of agents, including nuclear, chemical, and physical. Physical, such as sound, vibration, noise, x-rays, that are all part of the military environment, both deployed and when you're in garrison. The military environmental agents have the potential to cause adverse health effects, either alone or in a combination. The PACT Act defines the term toxic exposure, but generally, toxic exposure refers to a subset of military environmental exposures. Whether an exposure is toxic is determined by the substance, the concentration of the exposure, and the route of the exposure. Was it inhalation, ingestion, transdermal, intradermal, meaning it went in through the skin, intravenous, etc., and the duration of the exposure. So the PACT Act defines the term of toxic exposure as a general matter, but there are several types of possible exposures or hazards veterans may have experienced during their military career and service. Chemicals. A lot of us have heard of Agent Orange. Herbicides. Those were used very heavily during the Vietnam era. We have our burn pits. You have the sulfur fires in Iraq. Camp Lejeune, contaminated water supplies, pesticides used during the Gulf War, depleted uranium, industrial solvents. You have air pollutants, again, going back to the burn pits, oil well fires during the Gulf War, sulfur fires in Iraq. In Japan, the waste incinerator at Atsugi. You have sand, dust, very fine particulates or liquid droplets. Occupational hazards, asbestosis is very common for a lot of naval veterans, industrial solvents, lead, radiation, vibration, noise, fuels, polychlorinated biphenol, and special paint used on military vehicles. Radiation, you have nuclear weapons, testing, x-rays, depleted uranium, and warfare agents, chemical weapons, Project 112, / Project Shipboard Hazards and Defense, SHAD, herbicide tests and storage and chemical experiments. So how it's going to be expanding healthcare eligibility. Section 103 of the law requires the VA in a phased approach to provide hospital care, medical service, and nursing home care for any illness to 3 new categories for veterans. Category 1 is for veterans who participated in a toxic exposure risk activity as defined by the law, and while serving on active duty for training, or inactivity duty training. Category 2 is for veterans who were assigned to a duty station in and including the airspace above certain locations during specified time periods. And that's on or after August 2nd, 1990, in the countries of Bahrain, Iraq, Kuwait, Oman, Qatar, Saudi Arabia, Somalia, or the United Arab Emirates. On or after September 11th of 2001 in the following countries: Afghanistan, Djibouti, Egypt, Jordan, Lebanon, Syria, Yemen, Uzbekistan, or any other country determined relevant by VA. And finally, Category 3, veterans are those who were deployed in support of Operation Enduring Freedom, Operation Freedom Sentinel, Operation Iraqi Freedom, Operation New Dawn, Operation Inherent Resolve, and Resolute Support Mission. So the current schedule for the phased approach for the VA healthcare eligibility, veterans identified in Category 1 and 2 will be eligible beginning October 1st of 2024, and that's the veterans who were discharged or released between August 2nd, 1990 and September 11th, 2001. October 1st, 2026, veterans who were discharged or released after September 12th of 2001 and December 31st, 2006. October 1st, 2028, veterans who were discharged or released between January 1st of 2007 and December 31st, 2012. October 1st of 2030, veterans who were discharged or released between January 1st of 2013 and December 31st, 2018. Veterans identified in Category 3 will be eligible beginning October 1st of 2032. Veterans may be eligible for VA healthcare earlier if they meet certain service-connected illnesses or conditions, or if they meet existing eligibility criteria. So it extended the healthcare eligibility for certain combat veterans. Between October 1st of 2022 and October 1st of 2023, veterans who served on active duty in a theater of combat operations during a period of war after the Persian Gulf or in combat against hostile forces during periods of hostilities after September 11th of 1998, and who were discharged between September 11th of 2001 and October 1st of 2013 may receive care upon enrollment for VA healthcare. Enrollment is free, there is no annual cost, and your care may be free as well. So for the Vietnam veterans, and there was a question earlier about Vietnam, veterans who served in the following locations and time periods are also now eligible to enroll in VHA healthcare effective on enactment, which was August 10th of 2022. Republic of Vietnam between January 9th, 1962 and May 7th, 1975. Thailand at any U.S. or Royal Thai base between January 9th, 1962 and January 30th, 1976. Laos between December 1st, 1965 and September 30th, 1969. Certain provinces in Cambodia between April 16th, 1969 and April 30th, 1969. Guam or American Samoa or other territorial waters between January 9th, 1962 and July 31st, 1980. The Johnston Atoll or a ship that called there between January 1st, 1972 and September 30th, 1977. The PACT Act establishes presumptives of service connection for more than 20 conditions related to toxic exposures. So presumptive conditions means it's going, if you have that condition, and you meet the eligibility criteria, it's going to be presumed that that condition was a result of toxic exposure. So for your Gulf War and post 9/11 veterans, asthma diagnosed after service, brain cancer, chronic bronchitis, chronic obstructive pulmonary disease, commonly known as COPD, chronic rhinitis, chronic sinusitis, constructive bronchiolitis or obliterative bronchiolitis, emphysema, gastrointestinal cancer of any type, a glioblastoma, granulomatous disease, head cancer of any type, interstitial lung disease, kidney cancer, lymphatic cancer of any type, lymphoma of any type, melanoma, neck cancer, pancreatic cancer, pleuritis, pulmonary fibrosis, reproductive cancer of any type, and respiratory cancer of any type, and sarcoidosis. If you were in Vietnam or veterans exposed to the tactical herbicides, again, most commonly known as Agent Orange, monoclonal gammopathy of undetermined significance, MGUS, and high blood pressure, more commonly known as hypertension. So for filing and processing a claim associated with the PACT Act, the veteran will want to contact, or the VA is contacting veterans. We've been sending out a lot of different flyers, mailers, things like that. letting them know about the PACT Act. You can also go to this link, and this will be provided this slideshow to learn more about it. If you have a previously denied exposure claim and that is now a presumptive, you will want to file a VA Form 20995, a decision review request, which is a supplemental claim. Claims that were previously denied will not automatically be reviewed under the PACT Act. And if you have any survivors, they can of previously denied dependency and indemnity compensation DIC claims, they are also likewise encouraged to refile that claim. Veterans who have not previously filed a claim and are diagnosed with one of the new presumptive conditions and meet eligibility requirements should submit a new claim, and that would be on Form 21-526EZ. Veterans should be prepared to submit any supportive medical and lay evidence along with their claims. In addition to the PACT Act, it also has, separate from the PACT Act, the Dr. Kate Hendricks Thomas Supporting Expanding Review for Veterans in Combat Environment Service Act. And it also expands toxic exposure eligibility to veterans who served overseas. This was signed into law June 7th of 2022. The Service Act expands eligibility to clinically appropriate mammography screening for veterans of any age who served in the following locations. Does not include the bodies of water or the airspace above, though. Iraq between August 2nd, 1990 and February 28th of 1991. March 19th of 2003 until burn pits are no longer used. Southwest Theater of Operations, including Kuwait, Saudi Arabia, Oman, Qatar, between August 2nd, 1990 until burn pits are no longer used. Afghanistan, Djibouti, Syria, Jordan, Egypt, Lebanon, and Yemen, September 11th of 2001 until burn pits are no longer used. Such other locations and corresponding periods set forth by the Airborne Hazards Open Burn Pit Registry. Such other locations and corresponding periods is VA in collaboration with the Department of Defense. They may determine later on as appropriate. The Service Act does not change healthcare enrollment or claims and benefit application requirements. So VHA toxic exposure screening and education. Beginning in November of 2022, so here in a couple weeks, every enrolled veteran will start receiving an initial toxic exposure screening and a follow-up screening at least once every 5 years. Veterans not enrolled who meet eligibility requirements will have an opportunity to enroll and receive the screening. Veterans will be asked questions about potential exposure to an open burn pit and other hazards commonly associated with military environmental exposure. The VA healthcare providers and claims processors will also receive additional training and education on toxic-related exposures. Details on the training for the healthcare personnel are still in development. VA will publish a list of resources for toxic exposed veterans and veterans who receive toxic exposures, the families and caregivers of such veterans and survivors of such veterans. The VA will also develop an outreach program for veterans on benefits and support programs. So strengthening the VA's military environmental research, a multi-agency work group will identify collaborative research activities and develop a 5-year strategic plan. The PACT Act requires studies on the mortality rates of veterans who served in Southwest Asia during the Gulf War, post 9/11 veteran health trends, veterans cancer rates, effects of toxic exposure and mental health outcomes, effects of waste related to the Manhattan Project, the state of access and barriers to benefits veterans in U.S. territories, and effects of jet fuels. So here is a couple links again where you can get more additional information about the PACT Act, some information for how to apply for health care, how to submit a claim for veteran benefits, a 1-800 number for additional information, and then where to go to sign up for the Airborne Hazards Open Burn Pit Registry. And at that time, I am concluding this PowerPoint presentation, and I will hand it off back over to Scott.
Thanks, Mark, for that great information and all that wonderful information, that presentation. We're going to take some time now to answer some questions we received through the chat pane. We received a few already. Please remember, if you have a question, feel free to ask it by typing it into the chat pane. We'll get to it as soon as we can within the time remaining. If we don't get to your question, please know we still want to answer it. We will give you a way to contact us at the end of this presentation. Also, we will share the links that Mark had in his presentation in an email to you later on following this presentation. So our first question is there any benefit in the PACT Act for Vietnam veterans with exposure to Agent Orange? And I know you kind of answered that in the chat earlier, Mark, but if you could answer that, if there's someone else who should answer that question. And panelist, if you want to unmute yourself.
This is Larry Zietlow from the Veterans Benefits Administration. There are two new disabilities that have been associated with the PACT Act, one of which I cannot pronounce, and I don't think anybody else can pronounce. It is related to blood and bone diseases and things of that like. But the more important one, the one that you need to be paying attention to, is hypertension. Hypertension has been added as a presumptive condition to service in Vietnam. Be very, very careful. It doesn't make too much difference that you equate that with service in Vietnam and or exposure to Agent Orange. 3 different locations were mentioned as places where exposure to Agent Orange could happen, one of which was the air base at Thailand, and there were a couple of others. You need to make sure whether or not you were in one of those areas. But if you have now got hypertension and you served in Vietnam and were exposed, you need to apply. But I served in Vietnam 40 years ago, and I just now got diagnosed with hypertension. That's the very definition of presumptive. If that disability, if you were in that location, and now this applies not only to Vietnam, but to burn pits as well, so it's a good time to bring it up. If you are in the area that has been acknowledged as an exposure area, and you now have the condition, and it is a chronic condition, you will be considered service connected for that disability. The idea of being presumptive means you don't have to prove it. You need, though, and I'm going to say this a lot tonight, you need a diagnosis from the doctor. So if you have a diagnosis of hypertension and you served in Vietnam, you need to apply for VA disability for that condition. If you've never applied before, VA Form 21526EZ. And as Mark said, if you were previously denied for any of these conditions, using VA Form 20-0995. Thank you.
Well, and I think we should also go a little bit deeper into the presumptive aspect of this, is that, as you said, Larry, it's presumed automatically that that condition was in association with your military service, or it's now connected to that military service, which is a big change from before. So those people who have had issues in the past and have tried to receive a disability rating have had to prove in the past that it was connected with the military service. This is the big difference. It's now presumed. You don't have to go back and prove, in fact, that it was in connection directly with that military service. However, we also probably need to say that if you have records from previous treatments for these different conditions, that you might still have to provide that information. But also, I think we probably want to say that we want you to definitely go to the PACT Act registry and register and start that claim that way, whether you are already enrolled, whether you already have a claim, whether you've already registered for the burn pit registry or the Camp Lejeune registry or the Agent Orange registry. There's a new registry out there now at va.gov/PACT to register for this new PACT Act registry and start that claim as well. That's another way that we want to go ahead and direct people and start people in that process. So is there anything else that you would add to that, Larry?
I do want to add one thing, and that's the importance of the registries. I mean, I realize that there may be a misunderstanding. Why am I registering? What's the point? I don't have any of these disabilities, but I was there. I don't have them yet. Why should I register? It's that it was the Agent Orange registry over the last 30 or 40 years that allowed VA to connect and collect enough data to begin to add more and more disabilities to the presumptive service connections for Agent Orange. And if you were to Google presumptive service connections for Agent Orange, you'd probably find that that list has grown since the last time you looked at it. Hypertension is only the latest one. There have been 3, 4, 5 different disabilities added in just the last 2 years alone. So one, I encourage you to go look at that site, but please take Scott seriously. We need your help with the registry to identify who was exposed, what their service connected conditions are. Because one of the things that VA looks at is how many veterans have this condition who are in that area, who are in country, if you will, as opposed to veterans who do not have this condition. And that lets us say, yep, you were in country. It's more likely than not that you were exposed. So please register for that registry and allow Scott and his gang to keep you informed on what's going on.
Absolutely. Thank you, Larry. And to that point, we have a question that says, I received a letter in the mail saying I may qualify for benefits because of the PACT Act. What do I do now? Mark, would you like to answer that?
So that's where I would encourage them to contact your local VA medical center, ask for their enrollment and eligibility, and this is where Mr. Bird can get more into it, and see if you're eligible for any VHA health benefits, but also contact, and Larry would piggyback on this, possibly get with a veteran service organization to ask them to assist you with possibly filing for any VA benefits. You can certainly do it by yourself online. You know, we already mentioned Form 526EZ, but get with a veteran service organization and ask them to assist you for the paperwork and handling the paperwork. And they can also go over a list of certain conditions and presumptives. Do you have this? Okay. Was it diagnosed by an outside provider within the VA and stuff? But ask that organization to help you with that.
Absolutely. And for those of you who are enrolled, you probably already know what a veteran service organization is, or you'll hear the term VSO used. VSOs are actually county offices. There's usually a VSO office in every county building. So all you need to do is look into the county offices and look up the Veteran Services Organization. They are a great resource and quickly learning everything they can also about the PACT Act and how to help veterans register. Did we have any panelists who wanted to piggyback on that question?
Well, hey Scott, this is James. Just wanted to make certain and let the veterans know it doesn't cost them a dime to come down to the enrollment and eligibility office to get enrolled. We just require that you bring your DD-214, copy of your driver's license, any pertinent insurance. We enroll at the Dayton VA Monday through Friday, 8 to 4. If there's any questions whatsoever, we always send information to what they call the Health and Eligibility Center to double check a person's eligibility if we have some question. We also have VSOs, Veteran Service Officers, at our facility who are willing and ready to help any veteran that walks into our facility.
Yes, James, and I wanted to harp on that just a little bit. You've got a great group of VSOs there right at the VA Medical Center. I've also got a representative of the Veteran Benefits Administration, Miss Amber Freilich, and Amber works in that same area where the VSOs are, and she is a VBA employee. So if you don't happen to have power of attorney with any of those other organizations, or you want to work directly with the Department of Veterans Affairs, Amber can help you walk through that and any other claim that you might have.
Yes. And if I'm not mistaken, Amber is in the building Tuesdays through Thursdays, 9 to 3, or
That's correct.
That's correct?
That's correct. She's
Okay.
available. She's also available by phone on the other days, but we can make her available if we need her on one of the other days.
All right, terrific. Gold star for me. I wasn't sure I got that right. Our next question is, how can I tell if I'm on the Agent Orange registry?
So I would encourage veterans, if they're unsure, contact our environmental health coordinator, and it's at the Dayton VA's primary number, which is 937-268-6511, and then extension 3259. And he can easily look you up, see if you're on that registry. If you're not on the registry, he can go ahead and schedule you an appointment at that time, provided you are already enrolled at Dayton.
All right, terrific. Our next question is, does Camp Lejeune water now cover prostate cancer?
So this is, and Larry will probably piggyback a little bit. This goes into when we were discussing presumptive. At this time, prostate cancer is not a presumptive. That doesn't mean a veteran cannot be service connected if they served at Camp Lejeune more than 30 consecutive days and comes down with prostate cancer. However, VBA will adjudicate that on a case by case system. And it's also, for unfortunately, now a little bit more of the work falls on the veteran and possibly a veteran service organization, if they go with one, to assist in making that determination and that connection of how it was related to the contaminated water. There is a chance, if enough people come down to it, and this is where some of these registries come into play, they see a pattern, they could easily add prostate cancer as a presumptive. But at this moment right now, it is not listed as a presumptive. But again, doesn't mean it can't be service connected. It's just a little bit more work on the veterans side of things and possibly their VSOs.
All right, terrific. Thank you for that answer. Our next question is, VA denied my claim for hypertension, but with the PACT Act, will VA go ahead and grant my claim?
Okay, this is an excellent question, and it expands a little bit beyond hypertension. So if we previously denied your claim for hypertension, or for that matter, any other disability that might now be on the PACT Act list, you need to come and see us at VBA, the VSOs, the National Service Officers, American Legion, DAV, whoever your rep might be. Come down and see Amber at the medical center, or your county veteran service officers, and let us reopen that claim. There are, as we've mentioned already, different vehicles for reopening a claim that's been previously denied, as opposed to a claim that we have never adjudicated before, we've never made a decision on before. But leave that to us. We'll sort that out, and we can make sure that we get the right thing going. And the important thing here is that if you haven't been tracking the Agent Orange disability list, if you haven't been tracking any of these other registries, and it's been a long time since you talked to us, you need to come on down and let us answer the basic question: what am I eligible for? What benefits might I be able to get? And let us go through and ask you some pertinent questions. How's your hearing? How's other things that are going on? and let us make a determination of whether we might be able to file a claim. Don't let your buddies tell you that, oh, you're not eligible for that. Oh, that's not on the list. Oh, I applied for that and I can't get it. As Mark said, each of these is on a case-by-case basis. If it's not on a presumptive list, it doesn't mean you're not going to be eligible. We still need to get a chance to look at the actual records. It might be that you have this disability secondary to some disability, other disability that you had. There are a myriad of possibilities. So please let us take the opportunity to serve you.
All right, fantastic answer. Our
That's
next
where-
question is, my cousin deployed to Kosovo. He was in the National Guard and deployed for 6 months. Is he eligible for VA health care? James, would you want to answer that?
Certainly. He may be. Normally, when you are deployed, when you get out of the service, and this is why the DD 214 is very important, because there will be a campaign medal on that DD 214. And even if there's not, as I mentioned earlier in the comment, if we have any question, we will send your information down to the Health and Eligibility Center. We have what we call a HEC alert, and normally they answer within 24 to 48 hours with a reply. Again, very important, have your DD 214 with you. We do have other systems that we can look it up, but that is sort of like the golden ticket. Any other type of medical information that was mentioned that you could bring, because we're certainly going to take you down to our excellent VSO office, even after you see us, for you to ask any further questions as far as benefits.
All right, terrific. Our next question is, can a non-enrolled veteran just pay for out-of-pocket screening for getting a screening?
Absolutely no. Doesn't have to pay. All screenings are free. Just come on down to the Dayton VA, and we want to screen you. We want to make sure and that we take care of all the veterans. So the answer is no. Everything is free. Once
It's a
again,
good no.
it's a good no.
All right, fantastic. Thanks, James. The next question is, I had both my thyroid taken out and was involved with burn pit in Operation Desert Storm. Does that qualify under the PACT Act?
So, and maybe Larry can piggyback on this. Right now, at this moment, we're still waiting on a little bit further guidance at a national level. It does say cancers of the neck. However, thyroid condition is in thyroid cancer is generally considered an endocrinology issue and part of the endocrine system. We are still trying to get a little bit more guidance. Most people would consider cancers of the neck, the thyroid is located in the neck, so the thyroid is going to be connected. However, anatomically, it is considered part of the endocrine system, and this is where we're still waiting for a little bit more guidance at a much higher level. However, and Larry will probably agree with me, I would encourage the veteran, one, to sign up for the Airborne Hazards Open Burn Pit Registry if you have not done it. That's a two-part registry. You do the online, and then you'll have a follow-up health assessment. And that's where we have our Dayton's lead environmental clinician who can go over in details what all is involved during one of those health assessments. But then I would also encourage, go ahead and file for the condition. The laws are always changing. If you get denied, but then later on they could change the law, then it's a matter, depending on those situations, on how it affects. They're always changing the laws. They've added lots of people used to claim hypertension and they would be denied, the Vietnam veterans. Now they're going to be granted service connection and it's a presumptive. And this is where and falls into why you want to do these registries. It's also information data collection. We get enough people and we see thyroid cancer, it very well, if it is not going to fall into cancers of the neck, it could very, very well later on become a presumptive. This is where the VA gets this information and data.
Mhm.
Yeah, Mark,
Absolutely.
I couldn't agree more. You hit it, you hit it just right. I think, and if you've noticed any kind of a theme from all of us here, it's please apply for the benefit. Please apply for medical care. Please register at the VA Medical Center. Because as Mark said, as time goes on and we get clarification on these disabilities, we'll be able to narrow in more and more and more of what's happening. We looked at some of these lists and it says cancer of the head, cancer of the neck. That's a real wide open area. And, you know, you would think that we would have we'd have it narrowed down a little bit more. If it's going to be as wide open as neck, then yeah, maybe thyroid's going to be in there. But as Mark said, that seems like something we'd want clarification on. And we will get clarification on these things as time goes on. And as you know, I want to reiterate again, Mark said, it may not be now, but it may be later service connected. And you need to stay on top of this. You need to do these registries and you need to give us your information so we can keep track.
Yes, and we actually had somebody come in a little later on and was asking, because I think they had missed the first part of the presentation. They were asking, do they need to register on all these locations? You know, if they've registered with the burn pit, do they also need to register with the PACT Act as well? And the answer is definitively yes, absolutely. Just because you've registered in one should not preclude you from registering on the other. Certainly we're talking about the PACT Act tonight. We want everyone who feels that they have a presumptive condition to register with that site, but don't want to stop anybody from going also to the Agent Orange registry or to the Burn Pit registry or the Lejeune registry, et cetera, and so forth. We want you to explore every avenue open to you. Additionally, there was a question that came in about updates for the PACT Act. You know, Larry was just talking about that, where we've all been talking about how this is a very fluid process right now that we're going through with bringing on the services connected to the PACT Act. Well, the law was just signed last month. It's still fresh for us, and we're still getting a lot of guidance on what we're going to be doing and what services are being provided and what conditions are being treated and what conditions are presumptive. So as Larry said before, you want to continue to keep abreast of that. If you're wanting to know where to get that information, Mark, Larry, is it actually go to va.gov/PACT? Is that the best place to go to?
I would think so. That's a very, very good place to go. I have had a lot of folks who sometimes have difficulty navigating the complexity of the VA websites. And over the years, they've gotten much, much better. But oftentimes, a simple Google search, just watch out for the source of that information. All right. Look carefully at what is the source of that information. But a Google search will take you to VA authorized sites, both VHA and VBA, which will give you clear and definitive information.
Absolutely, and that's a great point. Make sure that you do go to the VA sites. There are a lot of folks out there right now who are expressing to us that there is different information out there. They don't know where to turn to. Go to a va.gov website to get that information to ensure that you're not going to a bad source. Next question we have, I heard there were dates when the benefits and enrollments would begin. When is that?
All right. So first off, the bottom line definitive date is was the date of the signature, October 10th. Not I'm losing, guys, help me out here. Was it not October 10th or was it August 10th?
August 10th.
August 10th. I am so sorry. I lost it there for a moment. August 10th was the date the president signed the law, and therefore all benefits are effective August 10th, 2022. When VBA pays benefit out, the date of the law is August 10th. The effective date of the award is the first of the following month, and therefore the first of the month is September. So the effective date of the rating decision of the disability will be September 1st. VBA always pays benefits at the end of every month. So the first benefit check that would be awarded would be on October 1st for somebody that had already been granted. We have already received, and we are receiving right now, 5,000 claims a day, PACT Act related. So we are in the process of gathering this information, sorting this information, getting these cases categorized properly, and getting them into locations where we will be able to begin to adjudicate the claim. You have seen or heard that we will not begin working on these claims until January. Others have said, well, then I can't file until January. No, you file now. We are gathering and we are creating the rules and regulations by which we will interpret the law and we will actually adjudicate the claims. And we expect to begin to adjudicate the claims after the 1st of January. We expect to have streamlined teams set up to move as much of these through as quickly as we possibly can. But the effective date of all of these is going to be August 10th. You may have, and I think in the original presentation it was mentioned that some of these disabilities were supposed to begin years down the road, hypertension being one of them. That is not true. Now they've made the change. Everything is August 10th. So please go ahead and file your claim, regardless of how long it takes us. That will be the effective date of your claim.
All right, fantastic. So our next question is, what goes on during a registry evaluation? And then what are the steps? I'm thinking maybe Forrest could answer that.
Sure. A registry evaluation is kind of like a history and physical, where we go into your past medical history, the reported medical history from you, you know, A through Z of all your medical conditions, ask you about your medicines you've taken, dates of diagnoses, places that you've been, exposures you've had, the various toxic exposures, you know, burn pit exposures, military pain exposures, embedded fragment type exposures. You know, there's a long list. You know, generally this type of visit is a good hour long, where you go A to Z into the medical history and then the military service periods and all the exposures, and then you put together a plan and bring the veteran up to speed on all the various presumptive condition lists that apply to the particular areas that they were exposed to. And then you educate them as to how to, if their main purpose and intent is to file a claim, you can go ahead and educate them on that. You can refer them, you know, tell them what avenues they can take to get assistance with it right there in the VA as you see them, or if they're already connected with, you know, a county service officer of some sort, you can redirect them to those people.
All right, fantastic answer. Thank you. Our next question is, how do you register? Where do you do that at? I'm going to say first that if you're talking about registering for VA healthcare, Mr. Bird had said earlier that all you need to do is come to the Dayton VA Monday through Friday, bring your DD 214. And James, you want to talk a little bit more about that?
Yes, again, Monday through Friday, we're open 8 to 4 o'clock. You want to bring your DD 214. You want to bring your driver's license. Any military information that you have. We will make copies of it, upload it in the system, and again, the registry only takes 30-45 minutes. Most of that time is the veteran filling out the paperwork. Um, but what I wanted to also add is with this PACT Act is not only for the veteran, it is also for the surviving members. Okay, so we don't want to forget that. So to let the spouses and the children know that the PACT Act is for them also.
Absolutely. That's a great point. There are survivor benefits associated with the PACT Act, and that is also available out there on the website to get more information details on. And that's again where survivors want to go to register and start that process and file that claim. Is they can go at to va.gov/PACT or go to their VSO offices, if I'm not mistaken, right, Larry?
Oh, yes, absolutely.
Okay, terrific. Next question. After reviewing the information regarding the PACT Act, where in the V can I go to speak to someone regarding questions that I may have? So I'll go ahead and answer that question. It depends on first what the questions are. If it's about eligibility, you want to go to our eligibility and enrollment office and talk to Mr. Bird's folks there. They're very knowledgeable and very helpful. They'll be glad to take you by the hand and show you how to enroll with VA healthcare. If it's about getting registered for the PACT Act, Mark's going to give us some more information, details about how to contact you. We'll be having some more information that we'll actually send out in emails to you tomorrow with links and phone numbers. And I think if you're just looking for general information about the VA, feel free to contact the Public Affairs Office as well, or patient advocacy. So the next question is an appointment required to go to the VSO at the Dayton VA, or can members just walk in?
Well, I know from experience, I am a 22-year veteran, Air Force veteran. Um, I I I heard Mr. Zetlow say, "Don't let your friends tell you no, no, no." I did that for years and didn't go. But to answer the question, first serve, first come, first serve. If you would like to make an appointment, they will make you an appointment. That is both at the VSO and eligibility enrollment. But we're open walk-in basis. You come in, we take care of you.
Great.
There is, of course, as we've mentioned, the opportunity to speak directly with VBA there at the Dayton VA Medical Center. And Amber is there 3 days a week. But there is also a program that we haven't talked about, and it's called VERA, VERA. And it is an online appointment program. And all you need to do is go to Google and Google VERA. And it will take you to the link where you can establish an appointment with one of our VBA counselors. I have 20 people in the state of Ohio who can answer these questions for you. You can make an appointment in the VERA system. We'll call you on the date and time of the appointment that you requested so that you can set up a time when you're available and you know where it is. Thank you, Santora, for throwing that up there in the chat. You can click on that link. It'll take you right there. And we will call you on the date and time of your appointment and answer any questions that you have. We do what they call virtual appointments, but they're phone call, and we can handle it right over the phone for you.
All right, we're going to take one more question. We're just about out of time here this evening. So the next question is, I was at Camp Pendleton and they burned everything. Can I sign up for the burn pit registry? Mark, you want to take that one?
So right now, the Airborne Hazards Open Burn Pit Registry is only available or eligible to people that served overseas in the greater Middle East, Southwest Theater of Operation, and then Djibouti, Afghanistan, some of those different countries that I mentioned earlier in the presentation. That is at this time. Maybe later on the VA will change that. But right now, those are the eligible country. And that's where the Airborne Hazards Open Burn Pit Registry is a two-part. You would go online, sign in, you put in your different deployments, where you serve, different things like that. And then at a corporate level, they will get back, look at those deployments, stations, duty stations and everything, and then verify those deployments, and then send you an email letting you know whether or not you meet the eligibility requirements for the Airborne Hazards Open Burn Pit Registry, or if at this time you are not eligible. But I would certainly still encourage people to sign up. Jordan, that recently got added. Previously, it was not a qualifying country and a qualifying location. Enough people were putting in for it, and it caused the VA to start really looking at things. Now it is an added country.
Okay, terrific. Actually, we do have one more question I want to ask you real quick because I think it's a really great question. They're saying, I'm already a service-connected veteran from the Gulf War. Why should I join a registry? So Mark or Forrest, you want to answer that?
So the reason you would want to go ahead and join, there is a difference between being service connected, which is through Veteran Benefits Administration, and the registries, which are run by Veterans Health Administration. The registry can be added and used as additional medical evidence for a claim for service connection. But by doing this registry, this also helps data collection for VHA, the healthcare, on what all conditions are the people, veterans, coming down with. When are they coming down with it? How long was, since their exposure, since their deployment, how many years did it take before they got this, health condition? These are some of the trends in the data that the registries collect, and then it helps the VA at a larger level decide, one, whether or not a condition should be added as a presumptive, but also where to put different research and funding and things. We didn't talk about this, but there is a thing called risk, wartime related injury and illness science or study center. So depending on your condition, you could also qualify if you wanted to participate in certain research studies and things. But this is why that data collection, it may not help you individually because you're already service connected for a lot of these different things, but it does help the VA collect data for your fellow veterans as well. So some of them may not be service connected, but this helps add that additional information. Maybe you're at 100% monetarily, you're not going to gain anything, but we do a registry and we add a couple more additional medical conditions that you have. They see enough of it, now it becomes a presumptive.
All right, great answer, Mark. Thank you so much. Well, that's about all the time we have for this evening's session. We hope you found this event both helpful and informative. Greg, if you want to put up our first slide for me. If we didn't get to your question, not to worry. If you have questions that you did not want to share with the group, feel free to contact our PACT Act program office at 937-268-6511 or at extension 5807. That's 5807. Or for information about applying for VA healthcare, you may call our eligibility office at 937-267-7608 for questions about how to enroll with the Dayton VA. For those who may not be currently enrolled with the Dayton VA for their health care, there are several other options for enrolling. If you're not currently enrolled but would like to enroll with the Dayton VA, here's how to do it. First and foremost is in person. We've talked about that a couple different times tonight. Just come down to the Dayton VA campus, go to the enrollment and eligibility office, as well as the C box that we'll be talking about here shortly. You can also go online and register online. Fantastic way to do that, or call the call center, or download the VA 1010 and mail it to our facility, and our enrollment people will reach out to you that way as well. Also, you can enroll at the surrounding community-based outpatient clinics, also known as C-Box. You can see their locations and phone numbers. There is a location in Lima, Middletown, Richmond, and Springfield. I want to say thanks so much to all our panelists for the great information they have shared with us this evening. And thanks again to everyone who attended this event this evening. Have a great rest of your evening, and thanks to all our veterans for their service to a grateful nation.